Afternoon and welcome everybody to this edition of Insight Thursday. My name is Bernard Woods. I'm the director and I'm the director of the Management and Aid Effectiveness Division in FPD. So I just want to say that as a man, it's a honor and a privilege to be able to moderate this discussion this afternoon on the topic of gender-based violence. And just to say, in terms of terminology, gender-based violence, I find the phrasing tends to hide or obscure a little bit of what we're talking about, which is violence against women perpetrated by men. So I think two key takeaways if you leave at 2 o'clock with two things. We'd like that to be a better understanding of gender-based violence as a development issue, and also the role of ADB, the institution that we work for, in preventing and addressing gender-based violence. So we started off today's insight with a poll. And I'm pleased to say the majority, although I would have thought it would have been a little higher, have answered questions on this. So just to say, these are all very common myths about gender-based violence. Let me just go through them just to discuss them a little before we start off. So gender-based violence is not an issue for just women. It's an issue that affects everybody, men, women, and children, and in particular affects the physical and mental health of women and children, and leads to poverty and marginalization. It's not a minority of men with mental health issues who are perpetrating violence against women. In particular, it's unfortunately a very common occurrence worldwide and is a socially and culturally learned behavior. Substance abuse, well, this may precipitate violent behavior or make potential victims more susceptible to violence. But we should recognize alcohol or any type of drug. These are not mitigating factors or an excuse for violence against women, and never should the victim be blamed in these circumstances. Of course, there may be in any relationship disputes or disagreements, but violence to resolve these disputes is not and never acceptable, and is not inevitable. It's a learned behavior and something that can't be unlearned. And finally, it's a myth that violence against women is perpetrated by strangers. So 2/3 of sexual assaults are committed by somebody known to the survivor. And some studies say that only 2% of abusers are complete strangers to the women who are victims. So thank you for answering the poll. I hope by going through this, debunks some of the myths about gender-based violence. So clearly this is a economic and social issue that has to be addressed. And to better understand our part in this issue as members of the ADB community and the role of ADB itself as an institution, I want to introduce our two panelists who are here to help us raise our awareness today. So the first one is Christina Pack. Let me tell you a little bit about her. She's the principal counsel in our Office of the General Counsel, or OGC. She's responsible for managing OGC's law and policy reform program, which designs, processes, and implements technical assistance projects directly to DMCs relating to legal and judicial matters. She also serves on the Gender Equity Thematic Group and is the counsel for ADB's accountability mechanism. And she's a technical assistance, partnerships, and knowledge focal point. I guess that she's from OGC. She is a lawyer, a US qualified lawyer admitted in the states of New York and New Jersey. So welcome to you, Christina. Maybe you want to turn on your camera so everybody knows who you are. Second is Myri McRae. So Myri's the gender specialist in the Pacific Department of the Asian Development Bank. She leads on gender analysis and gender knowledge products in the Pacific. She's worked for over 15 years on gender and women's rights issues and has expertise in gender-based violence. And this has included developing a rigorous evidence base on preventing and responding to violence against women and girls in humanitarian crises in particular. And her publishing includes the first ever prevalence study on violence against women in South Sudan. And she has a Master of Science and Development Studies from the University of London. Just before we start, I want to let everybody know, of course, this is a dialogue, but we want to hear from you. So we'll have a question and answer session at the end of the panel discussion. And if you can please submit your questions through the chat box, and then we will look at those at the end. So let me turn to Myri first. So Myri, you've been working in the Pacific on gender equality issues. There's many gender equality issues, as we know, across the Pacific. Why do you think gender-based violence is one of the most relevant gender issues? And why now in particular in this time of the COVID-19 pandemic?
Thanks, Bernard, for that question, and good afternoon, everyone. Thanks very much for joining us today. So I do really believe that gender-based violence, often shortened to GBV, the acronym, or sometimes referred to as violence against women and girls, is one of the most under-discussed but pervasive issues when we talk about gender issues. But first, I wanted to take a step back and actually look at what do we mean by the term GBV. Sometimes we just throw this acronym around without really understanding the meaning behind it. So gender-based violence, or GBV, actually refers to harmful acts directed at an individual or a group of individuals based on their gender that can result in physical, sexual, or psychological harm or suffering. And this can also include threats of such acts, coercion, arbitrary deprivation of liberty, and this can occur in both public and in private life. So the reason why sometimes GBV and violence against women and girls are used interchangeably is that women and girls often suffer disproportionately from GBV. But it's important to note that men and boys can also be targeted. And the term gender-based violence is also sometimes used to describe targeted violence against LGBTQI+ populations when referencing violence related to norms of masculinity, femininity, or other gender norms. I also wanted to take a minute to talk about how GBV links to gender and gender inequality, because GBV is both a cause and a consequence of gender inequality. Now, it's a cause of gender inequality because it presents a significant barrier to women's participation in progress. It's also a consequence of gender inequality because GBV is rooted in discriminatory and harmful social norms and attitudes, not, as we heard just now from Bernard, caused by substance abuse, poverty, or stress, although these can be trigger factors. But how big a problem is this exactly? Well, maybe some of you have heard some of these shocking statistics before. Worldwide, over 1 in 3 women have experienced physical or sexual violence at some point in their lifetime. And this figure doesn't include sexual harassment. So think about how much bigger that number would be if we were to include that. In the region that I work in the Pacific, in countries such as Papua New Guinea and Kiribati, this figure actually increases to 2 in every 3 women that have experienced physical or sexual violence. And this is just from their partner alone. And this is important to note that this also doesn't include psychological or emotional violence. We're just talking about physical or sexual violence here. One of the most shocking statistics I've heard, I think, is that amongst women aged 15 to 44, acts of violence cause more death and disability than cancer, malaria, traffic accidents, and war combined. So I think here you're getting a sense of the scale of gender-based violence. And all of this was before COVID-19 struck. So what we're starting to realize is that the conditions created by this pandemic, including lockdowns, reduced mobility, heightened isolation, stress and economic uncertainty, have led to an alarming increase in gender-based violence. And this includes increases in domestic and intimate partner violence, child marriage, and sexual exploitation. And whilst we don't have any prevalence data during COVID-19, we do know that calls to helplines and services have increased manifold. So for example, in Fiji, we know that calls to GBV services increased by 5 times during the lockdown period. So all of this is well and good, but why does this matter to us at ADB? Well, because the social and economic costs of this are enormous. From an individual level, with survivors suffering from physical and mental effects, loss of earnings, and increased costs such as healthcare costs, to the wider societal impact, and this includes lower productivity and economic output and increased pressure on public services. Now, a number of academic studies have tried to estimate the economic costs of GBV, and some of the findings are truly staggering. In 2016, the UN estimated that the global cost of violence against women was around 1.5 trillion US dollars. That's equivalent to approximately 2% of the global GDP at the time, or to put it in perspective, roughly the size of the entire Canadian economy. In the Pacific, it is even higher. In Samoa, it's estimated that the impact of family violence alone costs Samoa the equivalent of 7% of the country's GDP. The analysis was similar in Fiji and Papua New Guinea. But I think sometimes the statistics can hide the huge impact that GBV, or even the fear of GBV, can have on women and girls' everyday decisions and lives. But if you listen sensitively and ethically, you can hear this coming out in research and consultation with women, girls, and communities. So for example, in infrastructure and energy projects, I hear women talking about feeling unsafe on roads and wharves and public spaces where there is no lighting. I hear women talking about being sexually harassed on public transport. And I hear women and girls talk about what they need to feel safe in emergency shelters and in quarantine and isolation facilities. In education projects, I hear about how school-related gender-based violence is a major obstacle for girls and how child marriage forces girls to leave school. Just today, I heard in the Solomon Islands, someone told me about a young girl being raped on her long walk back from school. And globally, 1 in 4 girls say they never feel comfortable using a school toilet due to gender-based violence. In public sector management, I hear about how services for GBV are underfunded, how initiatives to improve women's participation in the labour market and women's economic empowerment need to also consider the sometimes violent consequences for women who are breaking the social norms of being at home. But to be honest, even worse is when we don't hear anything at all, because women aren't actively involved in consultations. And there can be many, many reasons for this, but one of them can be fear of speaking out and the repercussions of that for women and girls. So I don't think gender-based violence is only a human rights issue. I don't think it's only something we should be thinking about in social sectors. To me, it's really fundamental to all of our work, because I think if we're serious about social and economic development, and if we're serious about achieving our ambitions in Strategy 2030, we do need to recognise that GBV is a significant barrier to women's equal and active participation, and also vital to the growth of any economy. So now that I've bombarded you with lots of statistics and facts, I'll leave it there for the time being. Thanks.
Great. Thank you very much, Mari, for situating the issue in our context, which is development, and really explaining how this is a key concern for us at the Asian Development Bank. So let me now turn to you, Christina. As we heard, you're working with OGC. How did you get involved in working on gender-based violence? And what do you think are the specific entry points for working on gender-based violence that you've explored through your work?
Thanks, Bernard. First of all, it's great for OGC to be part of this important conversation. And as Mary laid out very well, there are so many reasons why GBV is so critical and why we all need to help. So many of you know about OGC's Law and Policy Reform Program, where we've been working with various legal and judicial stakeholders over the years. And one key stakeholder we have been working with are judges. In fact, through our commercial and environmental and climate change judicial capacity building programs, we have built strong relationships with over 30 judiciaries in our DMCs. So starting in 2014, we looked into the issues in the judicial system in addressing GBV cases, in particular addressing violence against women and girls. So the judicial system is a vital means of enabling women and girls to obtain equal access to justice for violation of their legal rights. Yet when cases are processed through the judicial system, women in many countries have expressed that court processes and court experiences have been insensitive to their legal rights. And there's a lack of awareness on gender issues throughout the judicial system. So in 2015, OGC launched the Legal Literacy TA to work with the judicial systems in Pakistan and Afghanistan, where gender-based violence is pretty bad. The situation there was that there are laws to protect women, and this is even enshrined in the Constitution. But there were still big barriers to protecting women and girls from violence in judicial system. And one key barrier is the lack of capacity in key implementing parties, such as judges, to handle these types of specialized cases. And this lack of capacity comes in various forms, from misinterpretation and misapplication of laws to harmful gender bias and stereotyping that Mary also mentioned. Also, there are institutional setups that basically impedes more sensitive and effective treatment of women and girls in the court system. So, you can imagine the tough decisions that women and girls have to make when they decide to prosecute their perpetrators. And oftentimes these are intimate partners. And when they seek protection under the judicial system, they face harsh realities. As a result, there are low conviction rates. Some women drop charges, or even more unfortunately, some women and girls are killed by their perpetrators while waiting for justice. So throughout 2015 and 2020, under the Legal Literacy TA, we achieved a lot. Under the TA, hundreds of legal and judicial service providers were trained to respond more effectively to GBV cases. There were positive media campaigns to increase legal literacy in men and women. But most of all, the Legal Literacy TA resulted in a model GBV court, which was replicated in over 100 courts across Pakistan, and under the leadership of our implementing partner, the Supreme Court. So with these great results, the Legal Literacy TA closed last year. But OGC wanted to build on the amazing work done in Pakistan and Afghanistan and bring our work to the Pacific DMCs and Timor-Leste, where the situation is also pretty dire. But in these places, we're also able to leverage the strong relationships with the Supreme Courts. So the situation in the Pacific DMCs and Timor-Leste is that even though there have been significant legislative enactments over the last 10 years to protect women and girls, but violence against women and girls are still very pervasive. And evidence suggests that laws alone are not enough to eliminate violence against women and girls due to the issues that I just mentioned earlier. So we approached our champion chief justices, and they indicated their willingness to help, because really without their buy-in and leadership, this work would be very difficult to do. We conducted stakeholder consultations and found that there is a unique role for OGC and ADB to play in working with the judicial systems to address GBV cases in the Pacific DMCs and Timor-Leste. Of course, it'll be important to coordinate with the development partners and civil society who provide the critical support services to complement our efforts. So based on these findings, we processed a new TA called the Promotion of Gender Responsive Judicial Systems. which was approved in December last year. And we also formed a 1ADB team with the Gender Equity Thematic Group and our PARD and CERD colleagues for more effective implementation. So, under this TA, we plan to work with judiciaries, magistrates, prosecutors, and other judicial officers who are involved in handling, investigating, prosecuting, and adjudicating these violence against women and girls cases by providing capacity building on the correct application of the laws, issues faced by survivors, addressing gender bias and sensitizing them, and also ways to improve judicial decision making. And this would be influenced by international best practices and standards. Furthermore, we hope to find more effective and faster ways to handle and adjudicate violence against women and girls cases, which is even more critical during COVID times. So we're going to look into designing fast-track court procedures and, where appropriate, put in place specialized GBV courts, such as in Pakistan. And these GBV courts are very helpful because it provides court personnel who are more gender sensitive. They are experienced in the unique characteristics of these types of special cases, and which enables them to process these cases more quickly. And also, we're looking into mobile courts to increase access to justice for women and girls living in remote areas. For instance, in Timor-Leste, mobile courts are used in criminal cases, and in few African countries, mobile courts have been used for GBV cases. And also under this TA, we plan to convene knowledge sharing events with our partners, other stakeholders on GBV issues to raise awareness and also to collaborate more. So I'll end there. Thanks.
Great. Well, thank you both for really giving us some insights there. We have about 8 minutes left, and we want to hear from the audience. Let me turn back to both of you quickly. Christina, first, you described the new TA and some of the areas you're intervening. Maybe in like a minute or so, can you just tell us what kind of results you're expecting to see by the end of the TA?
I mean, like I said before, I mean, we're really hoping to equip the judges and the judicial officers to better handle the violence against women cases and implement the laws more effectively. And we also hope to increase gender sensitization and decrease bias in their decision making, so they don't render detrimental court decisions that are basically on the books and future judges can rely on them. And then just really find faster ways and more effective ways to handle violence against women cases, whether by deeming them as urgent, so giving higher priority, fast tracking them, so putting in place faster court procedures. And again, where appropriate, putting in place specialized courts, or maybe training up a group of judges to specialize in gender-based, adjudicating these types of specialized cases.
Great, thank you very much.
But ultimately, we're hoping that we can play a role in helping to eliminate violence against women and girls.
Right.
Thanks.
Excellent, thank you for that. And then, Mari, let me turn quickly back to you. So we've heard about this example, very compelling example in the justice sector. What are the other links you see with gender-based violence and the work that ADB does?
Thanks, Bernard. So I can't speak to, and I don't have time to speak to all of the excellent work that ADB is doing across the whole Asia Pacific region, but perhaps I can give some examples for my own region in the Pacific, where I think we're doing some really interesting things. So, for example, in Kiribati, in an outer island maritime project, we're doing some really proactive work supporting training on GBV, setting up reporting and referral mechanisms for survivors. And as part of that, we've also set up a small support fund so that GBV survivors can actually access services. In Samoa, as part of a road project, we're actually training bus drivers on gender-based violence and how they should be dealing with this on their routes. And given what we know about COVID-19 exacerbating many gender issues, including gender-based violence, our CIPROs, our COVID-19 pandemic response options, we've really tried to include strong actions on gender-based violence. So things like ensuring risk mitigation of gender-based violence in quarantine and isolation facilities, public health messaging on gender-based violence, and actually support for new gender-based violence helplines for the first time in a number of countries, and adapting and expanding gender-based violence service provision. We also have a technical assistance, which is helping us focus more on building a rigorous evidence base, specifically looking on what we can do to prevent gender-based violence in the Pacific. And I just wanted to end by saying that whilst it's certainly a personal area of passion for me, we of course aren't doing this work at ADB just because of that, but actually because it's a target in the Sustainable Development Goals in SDG 5, and it's also a key part of our commitment to operational priority 2 on gender equality as part of ADB's strategy 2030. So I think it's just also important to recognize the role this work plays as part of our results framework as well. Thanks.
Great. Thank you very much for that, and for reminding us, yes, this is enshrined in SDG 5, which all governments have, including ADB, have signed up for. So we have a couple of questions. Let me just maybe ask you to respond very quickly, both of you, on this first question. You're dealing with government counterparts, the government ministers, judges. I imagine that can't be too easy on this topic. Some of the challenges and how you've addressed that. First to Christina, and then I'll turn to Myri.
I mean, this work isn't easy to bring up to judges and government officials. But I think through the relationships that we built with the judiciaries, and we've found the champion judges that can really help advocate for this work. But there's a lot of challenges in working with the judiciaries that we have to deal with, like the misapplication of the laws and misinterpretation, and the gender biases, and also ways to find tailored ways to, I guess, speed up these types of cases, adjudicate these types of cases. And also in Timor, there's the language issue, because although Portuguese is the official language, many of the lower level courts don't, they read and understand Tattoon. So I think in our capacity building, it could be a challenge in rolling out our trainings, and also with our knowledge resources. So that is one of the big challenges in Timor that we expect to see. So we'll see how that plays out with the stakeholders. Thanks.
Great, thanks. So Myri, same question for you. Dealing with
so I'd say that actually COVID-19 and the pandemic has actually helped raise the issue of gender-based violence to the forefront. There's been lots of noise being made about the increases and the impacts of COVID-19 on gender-based violence, and I think that's really helped certainly open the discussions in terms of our COVID-19 response. And certainly in the Pacific, there's a very active civil society, lots of active women's rights organizations, and the ministry or departments of women are raising this issue. So that helped kind of open the door for us to discuss these issues. And also in the Pacific, actually, GBV response systems are already in place. There are a number of capable service providers. So it was actually quite easy for us to scale up support quickly in response to COVID, rather than trying to set up something new, which obviously takes a little bit more time. Thanks.
Great, thank you for that. So it's about 1 minute to 2, so I think we should close it here. There's a couple of other questions in the chat box. Maybe I can ask our panelists, Christina and Myri, if you can respond offline to those. maybe just let me try and summarize some of what we've heard today. We've heard how gender-based violence against women, it's a development issue. And ADB and all of us have a role to play in the prevention of violence against women and gender-based violence. We've heard different paths, different contexts from the justice system, moving from South Asia, Central West Asia, to now Timor-Leste, and how ADB is kind of building on some of its great work there. And then we've heard a lot of cases from the Pacific, how the kind of barriers women are facing, women and female children are facing, and how ADB can help that. And I really think this shows how all of you participate in this discussion. So stay safe, everyone, and thank you very much. Have a great day. Bye-bye.
Thanks, everyone. Bye.
Thank you. Bye.